So how many treatments, if somebody has acute or chronic pain, would they need in order to see relief? Well, it requires stepping back and now analyzing pain again in a bit more detail. Ultimately, what we see happen when somebody suffers pain, or injury, I should say, there's this pain adaptation model. So what is the pain adaptation model? Well, if I injure my shoulder, specifically I experience pain when it goes this height, parallel to my clavicle, what certainly am I not going to be doing in the next week or so if I'm experiencing pain? I promise you that this shoulder will not elevate and my elbow will never go to this height. I'm going to limit my movement. And so what we see is that limitation, not moving it, can result in muscle atrophy, the loss of that muscle tissue. So what that means is the muscle shortens, the connective tissue that surrounds it shortens. Interestingly, the nerve that innervates that muscle tissue also experiences changes. And that peripheral neuron that then corresponds with the central neuron, there's changes there as well. These are two concepts known as tissue plasticity and neuroplasticity. Your tissue changing, its structural conformation because you're not using it. Your neurons and your neuronal system in your head changing the way it sends signals and the way it interprets pain because of the issues that you're experiencing. And so that's what transitions acute pain into chronic pain. And so when somebody comes in and says, I've been suffering from this for a year or a day, what you have to evaluate is what is the degree of structural changes? What is the degree of the change in the neuronal system or the nervous system? And then that's ultimately going to dictate or determine how many treatments you need to experience or undergo. But understand this, and this is very important, that the FDA clinical trial, which again was placebo-controlled, randomized, double-blind, multi-centered. What does that mean? A lot of complex jargon. It means that patients had no idea what type of treatment they were getting, real or fake. The doctor evaluating them had no idea whether they were getting real or fake treatment. And in that study, patients receiving actual treatment with EML laser saw immediately after a 50% reduction, and these are chronic pain patients that were experiencing pain for 3 months or greater. That lasted into the 24-hour period and then into the 72-hour period. So now you're looking at immediate changes that's perceptible to the individual after a single treatment. And so it may take a little bit more, maybe 3, 4, 5 more treatments once a week to restore that tissue functionality and to help sustain the result. But what you can rest assured when it comes to the EML is backed by that type of clinical trial that shows there's immediate reduction in overall pain.